about hemorrhoids. These little demons were my constant companions from around month 6 of pregnancy to 6 months postpartum. These little beauties cause itchiness, soreness. They're usually pretty embarrassing. And they can range in size from the size of a chickpea to a grape. Okay, so what exactly are they? So hemorrhoids are caused, or they are, swollen veins in the lowest area of the rectum or anus. And internal hemorrhoids, which happen, often go unnoticed, but external hemorrhoids mean that the swollen veins poke out of the anus. Sometimes a blood clot can form in them, something called thrombosis, and that can turn the hemorrhoid like blue or purple. So, and if you're having a bowel movement when you have hemorrhoids and you see some blood, it's probably caused by the hemorrhoids. If you have excessive amounts of blood when having a bowel movement, definitely let your care provider know. But if there's just a little bit of blood when you wipe, it's probably the hemorrhoids. Okay, so these little beauties can be caused by a few different things. So the pressure of baby on the anus, on the rectum, progesterone in your body, it can actually relax the walls of the veins, which can lead to some swelling in the veins. Heavy duty pushing when pooping or pushing a baby out. Most women, if they do the hardcore pushing when getting the baby out, you're going to get some hemorrhoids. It's almost a guarantee after vaginal birth. Okay, what else? Serious exertion when doing something like lifting a heavy object, or simply just having a lot of excess weight just puts more pressure on the veins in the anus. Okay, so luckily hemorrhoids, they usually go away after a few weeks, but if you have external hemorrhoids, you'll always have these like skin bags poking out of your anus forevermore. They're much less noticeable than the actual hemorrhoids that are like filled with blood, but still a little bit embarrassing. But they shouldn't hurt, they shouldn't itch. Sometimes it makes it a little bit more common for you to develop hemorrhoids because you have those skin bags, and sadly, this is probably TMI, but I've been very prone to hemorrhoids since having a baby, and that was 7 years ago. And sadly, I'm also a pro at dealing with them. Not something I'm proud of, but there it is. Okay, so now I'm going to show you some pictures. Just kidding. Okay, so what to do? Sit on a soft surface. So swap hard surfaces for soft by just sitting on a pillow. People used to sit on those like donut cushions that had a hole in the middle, thinking that helped, but it's actually been found that those donut pillows can actually increase the discomfort of hemorrhoids. So just sit on a regular pillow, ice them. So just get a piece of ice, sit on the toilet and hold the ice on the hemorrhoids, and that can reduce the swelling, which reduces the pain. You can also swap traditional toilet paper for witch hazel pads. So traditional toilet paper typically does not do a good job of getting all the fecal matter out from all the nooks and crannies around the hemorrhoids, and this can lead to more itchiness. So witch hazel pads are great because they have a lot of moisture, which helps to do a good cleanup job, and they also help to relieve itchiness, pain, swelling. Hemorrhoid cream can also do that. A lot of hemorrhoid creams have lidocaine. Yay, numbing. And they also have healing ingredients like hydrocortisone, vitamin E, and aloe vera. You can drown the hemorrhoids in a warm bath, so sitting in a regular tub or getting a sitz bath, which is essentially this kind of like mini tub that you fill with warm water, and you just stick it in the toilet bowl and you dunk your butt in it. You can also put Epsom salt or a splash of apple cider vinegar in the tub or the sitz bath to increase the healing. Loading up on fiber and drinking water is a great idea because a lot of times hemorrhoids are caused or can be agitated by constipation. So you really want to load up on fiber-rich foods like avocados, lentils, chickpeas, oats, chia seeds, almonds, pears, raspberries, and of course, prunes. Yum. Okay, in addition, you want to drink a lot of water because that helps to soften the fecal matter and makes it easier to get it out. You can also use a footstool when pooping. So a footstool kind of gets your knees up, gets you into more of a squatting position, which stimulates the bowels and requires you to exert less effort when pooping. And finally, see your care provider if they're really bugging you. Typically, hemorrhoids aren't dangerous, they're just really uncomfortable. But if they are exceedingly uncomfortable, let your care provider know. All right, if you have any questions about hemorrhoids or fun stories about them, let me know in the comments below.